Ngāti Andu. My name is Daryle Rigney, and I'm a citizen of the Ngāti Nation and a professor at the Jumbunna Institute for Indigenous Education and Research at the University of Technology, Sydney. I want to begin, as part of my cultural protocol, by acknowledging that I sit on the lands of the Kaurna people as I speak to you today, and I pay my respects to the elders past, present and emerging. On behalf of the Jumbunna Institute, we are proud to launch the discussion paper, Indigenous Nation Building and the Political Determinants of Health and Wellbeing, in partnership with the Loitch Institute. The paper demonstrates that self-governance and self-determination through nation building results in improved health outcomes for Indigenous peoples. It sets a framework for Aboriginal and Torres Strait Islander peoples to take control of their health and wellbeing through Indigenous nation building. Nation building is when Aboriginal and Torres Strait Islander collectives enact their sovereign responsibilities to lead change through self-government. Nation building is about self-determination for our peoples, so they can lead on decision-making about the issues that impact them most. It is important for communities to have local control over primary health care and wellbeing programs to focus on the relevant social, emotional and cultural contexts that support healthy lives. One example of nation building that we outline in this discussion paper is in the area of repatriation. The making of decisions, good decisions, effective decisions around the governance of the return of those old people, the ancestral remains that have been taken, and associated funerary objects, as well as other cultural objects, is an important nation-building project, one that goes to the very heart of health and well-being for Indigenous populations as we bring our old people home. Those ancestral remains are important that they return to country so they can be at peace and they can be at rest. That's an important health issue for our communities. You can read more examples in the report from across Australia and internationally to show how individual health and community wellbeing both stand to improve when Indigenous peoples are empowered to govern their affairs. The key finding in the paper outlines that Indigenous nation building enables healthy futures for Aboriginal and Torres Strait Islander peoples because it comprehensively enacts self-determination and so addresses the broad social, cultural and political determinants of health and wellbeing. Good health relies on good governance, effective governance of the wider social, economic and cultural supports. It's so important for our communities to maintain connection to lands and waters, to continue to develop thriving economies, to rejuvenate, grow and maintain languages and traditions, and provide culturally appropriate schooling throughout the life course. Understanding our right to govern is central to the ongoing advocacy of Aboriginal and Torres Strait Islander leaders seeking transformations within the Australian political landscape. I urge you to please read the paper and stand in solidarity with our peoples as we determine our health and well-being. Thank you.